Good morning.
Say hello.
Hi.
Who am I saying hello to?
Oh, should we? I don't think the video's on.
Oh,
Should see it?
yes.
Oh, here we go.
Now I can see you.
Hi.
Hi, good morning.
Hi.
Good morning.
I'm Gina. I'm one of the faculty in medical imaging. Who do I have the pleasure of meeting with today?
I'm Abigail Nolan.
Okay, because we're only expecting two. We're expecting Abigail and Alexandra, so we're waiting for just one more. How was the session this morning?
It was good. I learned a lot.
Good. This is a new endeavor for us all. I've never done open house from my kitchen before, but it's working out okay. And is that your mom that we
Yes.
have with us?
Hello.
Good morning. How are you?
Good. Very well. Thank you.
Good. Good. Glad to hear it. So Abigail, you're a senior now, correct?
Yeah.
Okay. And I looked, and so you're deposited. It seems like this is your final decision.
Yeah, pretty much.
It's a big one. So congratulations on actually making it.
Thank you.
You know, and it's a big one in a challenging time. I do not envy you, and Mom, I don't envy you either.
Oh, okay.
It's been, it's challenging to make that decision for college, and then certainly with the complications that we've had from COVID, I'm sure that made it a little more complicated.
Yes. Well, we lucked out because we went to see your campus when she was in sophomore year.
Excellent.
So we were ahead of the game, which I think helped us out a lot. And, like she likes your school because I don't want to speak for her, but she does like the small campus, and she's always been interested in medical imaging because they had career day at elementary school.
Oh, okay.
And she was all proud of herself because she was the only one that realized there was a wrist fracture going on when the radiologist held up his example of the x-ray. So
That's fantastic. That's a great story. You should be
Yes.
sharing that when you come forward with us. Yeah, it's kind of like a sign that this is meant to be for you.
Mhm.
So when you came, did you just do a campus tour, or did you do an actual open house?
we did the open house.
Yeah.
Yes.
Okay.
Mhm.
So if it was me and I don't remember, I apologize. But it may have been our department chair, Paula Schloter, because
Yes, I believe it was her. Yes.
she
Yes.
served in this role for quite some time.
Oh, is she no longer working there, or?
She is the chair, but admissions kind of changed the way that they do things, and the chairs are no longer doing the admissions piece. The chairs will pick a member of the faculty to kind of serve in that role. And so,
Oh,
so they picked me because they think that I'm the cheerleader.
Oh.
So, I'm a graduate of the program.
Oh, okay.
Very long before you were born, Abigail, I'm sure. And then I worked out in the field for about 10 years, and then went back to school for a master's in education. And then after I completed my master's, I went back to teach. So the program is near and dear to my heart as both a student and now as a faculty member.
Oh, great.
I served as the clinical coordinator for 12 years. So any questions that you could possibly have about clinical, I can absolutely answer for you. I've been a full-time faculty member for, this is my 15th year.
Oh, wow.
Yeah. So,
Okay.
any questions about coursework, I can certainly ask for you. I don't usually prepare like a presentation for open house. I like to give you guys an opportunity, to ask the questions or seek clarification that you might need.
Okay, we did have a question. Now, she's done a couple of dual enrollment classes. Actually, she's involved in one right now, which is the medical terminology at the local community college. So I guess our question is, we would be sending the transcripts to you guys. Now, is it historically that some of those could possibly apply, or maybe not?
Absolutely. So dual enrollment, generally most of them apply, but dual enrollment isn't usually major related courses. It's usually stuff that would apply to the core curriculum. So, an English, a history, a psychology, those are generally the dual enrollment. But certainly medical terminology is a required course in the major. I teach it. So what will happen is you'll send in those transcripts. The registrar then will actually send them on to me. They'll probably ask for a course syllabus as well.
Okay.
And then, you know, I will look at them and compare it to what we're offering just to ensure that she hasn't missed out on anything.
Okay.
As long as she has, you know, hit all the markers that would make it equivalent, those will transfer in. The only limitation to those is we usually limit it to 12 credits that would transfer in.
Okay, she has right now, well, she'll have the 3 from Brookdale for the medical imaging. She did take anatomy and physiology through Seton Hall.
Oh, wow. Okay.
So she did that last year as part of her junior curriculum.
Okay.
And
that was 4 credits.
then she's also taking, now this is the one that may not apply. She's taking abnormal psychology. I don't know if that would, I know there's some elective credits, I believe. So I don't know if that would apply to possibly an elective situation, because I don't really think abnormal psychology is part of the core curriculum.
It's not our core.
Right.
Our core is intro to psych, and then, and one of, so it's usually it's 2 from each core piece.
Okay.
But the way that ours works is it's 1 psych and 1 soc. So there'd be 1 sociology. But
yeah,
you were saying, Abigail, you think that the AMP was 4 credits?
I think it was 4 because it was.
yes, but she had the lab, so
You
yeah.
have a lab because it's usually, okay. Now our med term, guys, is it's only a 1 credit course. It's not a 3 credit course. So we would have to evaluate those. Our AMP is 4 credits, but again, because it's required for the major, can't guarantee that would transfer, but certainly we would want to look at that. I mean, that's super duper important. The med term, if it transferred in, what it essentially will do is it'll transfer in as the 3 credits, but because ours is only 1 credit, it's, I guess, in essence, 2 credits that she doesn't need.
Okay.
As far as free electives, Mom, the way that it works is we have 9 credits of free electives in our major.
Okay.
And they can be, you know, any course of the student's choice that they want to take. So my sense is from this conversation, and certainly I will follow up with the registrar for you.
Okay.
Because we're looking at bringing in 7 that would apply to the major, that, you know, 12 credit transfer, we may be able to manipulate that a little bit for you. Because they're major courses, you know.
Yes.
And then essentially what this does for you, Abigail, is we are very structured in medical imaging in terms of when our courses are offered. So in order to earn the baccalaureate degree, you need to earn 120 credits. And then what happens is we lay out a plan for you and essentially say, you know, freshman fall, we anticipate that you should take 15 credits. And then, you know, sophomore spring, we anticipate 16 credits. And essentially it's just a numbers game.
Yeah.
So what happens is when you transfer in credits, then those semesters where we would suggest 16 now can become 14 because you've transferred in credits. So it can lower the number of credits that you're required to take in a semester, which is very, very good. And then depending upon how many you transfer in, we could potentially get you a graduation date that is a semester early. And that's generally what happens with students who transfer in AP credits. So instead of graduating in May, and for you it would be 21, 22, 20, May of 24, we could get you out in December of 23.
Okay, now would that stay in place though if she, depending on what track she goes, because she's been thinking about which way to go there as well, and she's kind of thinking she might go the ultrasound certificate route.
So the way that one works is in the spring semester of the senior year. So that would be that semester that you could potentially eliminate with those transfer credits. That's when you begin ultrasound. So what essentially would happen was you would not have any additional medical imaging or core to take in that spring semester. You would just be doing ultrasound. All right. If you didn't transfer in credits, what happens is in that senior spring, you still have it's 1 course in medical imaging. The first 7 weeks is what we call issues in medical imaging. And then the second 7 weeks of that course is your registry review. But if you are going to graduate in December, that would already be done. So she's going to transition into that sonography in that senior spring. They do their clinical during the week, and then their classes are offered every other weekend. Okay, so whether you chose the certificate in sonography or if you decided you wanted to actually not come to medical imaging and get a degree in sonography, which I don't want to see you do, the courses are always offered every other weekend. So you kind of would stop being what we refer to as a traditional student once you transition into that sonography piece. That sonography piece then, from that May, you would start in that May and finish that certificate the following March.
Mhm.
So essentially in, a little bit over 5 years, you'll have a bachelor's in medical imaging as well as a certificate in diagnostic medical sonography.
Okay. Now, when she goes to get a job, would she run into any barriers? Because let's say she did do an ultrasound job eventually. Would they say, oh, but you only have the certificate? Or they're saying, we know you have the bachelor's, so, the certificate's fine. Like, how
So
does that work?
essentially, when we are, and whether we're talking about sonography or whether we're talking about medical imaging, okay?
Okay.
When employers are looking at them when they come in, what they're looking at is, are they registered? Okay,
Right.
so what we are doing in imaging is preparing you for the national examination in radiography. So you'll be able to pass the examination and use the credentials RTR, which is Registered Technologist Radiography. The sonography certificate then is preparing you to sit for your registry exam in diagnostic medical sonography, giving you the right to use the initials RDMS.
Okay.
The difference is that sonography has 3 exams because they test on body areas as opposed to the body as a whole.
Mm-hmm.
Everyone has to take abdomen. Everyone has to take a physics and instrumentation examination. And then there's one other one, and I apologize that I don't know it off the top of my head because I'm not a sonographer.
Right.
But medical imaging is just one examination, okay? So they would never look at her and say, oh, it's just a certificate. They would say, is she registered?
Okay.
Oh.
But what they would look at, as far as that bachelor's degree goes, is they'd say, ooh, this is someone now who, if a supervisor position opens up or a managerial track opens up, we're going to look at her first. Did you look at other programs, like medical imaging programs?
Yes. Do you want to speak about that?
Where did we go?
Okay. So she looked at Quinnipiac.
Oh, the college.
And she had also put down, which she's only done it virtually, but the Massachusetts Pharmacology and something science school.
Okay.
And Suffolk University also has, actually one of those has a radiation therapy program versus the medical imaging.
Okay.
But it was very hard to find, that bachelor's. Yeah. Now, because like right near us where she took it, where she's taking the medical terminology at Brookdale Community College.
They have a 2-year.
That's right. So, but my thing, I'm an occupational therapist myself. So
Okay.
I know already, for her, I would rather see her get right in. You're getting the 4-year. We don't have to play the game that you do the 2 and hope that you're getting in, when you want to go get another 2 years. So
Absolutely.
that's why we liked your program. And of course, we were looking at the pass rates and, it's phenomenally, has a phenomenal pass rate. So, it really, your school has all the, things she checks because she
Check all
wants
the
a
boxes,
smaller
yeah.
school. That's right.
Yeah.
So, and plus we like that there's the options of she could do the radiology, but she could also do the ultrasound, or she could be doing the masters, or she could, there's a lot of different scenarios there. So
Absolutely.
that's a plus too.
And the reason I asked the question is because we are one of about 32 bachelor's programs in the country.
Right.
And obviously you guys have done your homework. You're
Yes.
looking at our
Yeah.
path
She didn't
rate.
want to go too far either because
Yeah.
yes, I saw other states had phenomenal programs as well.
Where are you guys?
We're in Jersey. Yeah.
Okay, so it's not too far. Okay.
Right.
So again, our pass rates speak for themselves, and we're
Correct.
very, very proud of that.
Yes.
And when you look at the associate degree versus the bachelor's degree, and again, Mom, you get it. I assume have a master's.
Correct. Yes.
And it was straight through. That's the move for a million different reasons, to do it right from the very beginning. The other thing about it is, in addition to having, the sonography track option, the management track option, you, in our senior year, Abigail, you're going to have the opportunity to do an internship in an advanced modality of your choice. Even if you opt for the sonography certificate, what will happen is in your fall semester, you will get 2 days a week of clinical experience in one of those advanced modalities. So it could be radiation therapy, CAT scan, MRI, cardiac catheterization, mammography. We have kind of looked at it and have found by interacting with the sonography department that mammography or CAT scan generally are a good fit for someone going into the sonography track, because you get the opportunity to get some skill in cross-sectional anatomy. And then as far as the mammography would go, mammography and then breast ultrasound, breast MRI are generally done in conjunction with one another. So for you to be able to have the experience of, you know, the mammography stage of, you know, diagnosis and treatment, and then to go on to the sonography stage. So, you know, you're still, in addition to the sonography, you can absolutely still get some more experience in another modality. If you were to decide that first of all, you don't have to decide on the sonography track until your junior year.
Okay.
So when you come in, you know, you can say, yes, I'm going to pursue the certificate in DMS. But if you opted to change your mind, you know, in sophomore year, you said, you know what, I don't really want to do that. I like radiation therapy. You're not married to sonography. Okay. So I think I just want you to understand that.
Yes.
You need to apply to their program. So in the junior year, you will apply to sonography, and assuming that you meet all the qualifications, you know, then they'll make the decisions, and you'll know then going into senior year whether you're accepted into the certificate or not.
Okay.
If you opted to not do the certificate, you would then have the full year internship of your choice. So instead of just the one semester, you would have two, okay? If you opt to graduate in December, all we would, essentially the way that we do it is in your fall, you have 2 days a week in your internship, and in your spring, you have 2 days a week. If you go sonography, your spring 2 days a week becomes sonography clinic. If you go straight medical imaging and graduate in May, 2 days a week in the spring, 2 days a week in the fall, internship. If you graduate in December, 4 days a week in the internship. So you're actually getting the same amount of time in the internship, regardless of whether you're a May graduate or a December graduate. And what we have found is that probably about 70% of our graduates end up employed in that specialty area. And it makes you so much more marketable when you are applying for jobs and you say, I have a bachelor's in medical imaging and I have a 1-year internship in CAT scan or MRI or radiation therapy. I mean, and you know, your mom can probably tell you this, Abigail, you know, facilities now, they want people who are duly credentialed, who are multi-skilled, who can do multiple things. That is going to give you a huge advantage over someone with an associate degree and only the radiography experience.
Yeah.
Yeah. Right. Yeah.
You know, so you do have a lot of options. And then what happens when you come in is you're going to be assigned an academic advisor. And in our program, what we do is we stay with you for your 4 years. So each year, twice a year, you meet with your academic advisor, we pick your courses, we sign off on them. So your academic advisor would be the one to say to you in that junior year, okay, you know, if you're going to go the sonography track, it's time to apply, and kind of help you through that process.
Okay, great.
In the junior year, you're also going to have a course with Paula Schloter, our department chair, that's called Advanced Medical Imaging. And that's where you'll be introduced into all those different modalities. She uses a multitude of ways to kind of introduce you. A lot of guest speakers come in who are working in the field. So you're going to get a whole lot of didactic information about what your options are. In the junior year of your X-ray clinical, we're going to give you a chance to observe in 5 different areas. You pick them. You get to look at them all, so that then when you have to make your decision about what you want, it's an informed decision.
Okay.
You've
Which
learned
is
about
great.
them, you've
Yeah.
seen them, you know, so it's, and it seems like from the type of people that you are, that will work well for you. You do
Yes.
your homework. You want to know, you want to make informed decisions, and we're going to help her to do that.
Okay, perfect. Okay. Do you ever find that you're able to kind of see which person kind of fits which of those areas? Like, have you noticed that? Okay.
Absolutely. And, you know, a lot of it is personality driven. You know, you talk about something like cardiac catheterization. All right. We're talking about people who we are imaging in the midst of a heart attack. You know, you have to have a certain kind of personality to be able to do that.
Right.
So if I see a delicate little wallflower and she's saying to me, I think I want to do cardiac cath, I say, okay, go see it for a day and then tell me how you feel afterward. You know,
Right.
So we can kind of see it. I play this little game where I say to them, like when I have them as sophomores, I say, I'm going to predict what I think you're going to pick your internship in. And generally I'm right, you know?
Right.
So yeah.
Well, the same thing happened for OT because, you know, like one of our units was on burns. Well, I couldn't even watch the video. I was like, oh my God.
Not it.
So yeah. So I feel like what you're saying about personality and what you can handle really drives it a lot of times. Yeah.
Oh, absolutely. Absolutely. And, you know, I mean, ultimately the decision is up to the student. Okay. But we have a moral and an ethical obligation to say to a student, I'm concerned that you're opting for a road that may not be the best choice for you. At the end of the day, the decision would be hers, but certainly her academic advisor, her clinical instructors, the people who have interacted with her, her professors throughout the years would be honest with her and say like, yeah, this is a great move for you, or you might want to reevaluate that.
Right. Okay. Great. Okay.
All right.
Yeah, and like you said, the small piece of it I think is really helpful. There's only 6 full-time faculty in medical imaging. So we know you very, very well. We know you on, you know, more than just a classroom level. We know you on a personal level.
Right.
And that kind of helps make those conversations a little bit easier, you know,
Yes,
to be able
yes.
to say, I feel like I know you, Abigail, and I feel like I can say to you, run with this. It's great, or scale it back. Let's revisit
Okay.
this.
Okay. Now, let me ask you this. With the new science building, do you have any part of that as far as having a piece in there or not really?
As far as coursework, if she needed to do the bios again, the anatomy and physiology, that would be over there. And
Okay.
physics,
Okay.
her physics courses will be over there. We are, and I don't want to use the word stuck because I think it's a negative connotation, but our location is our location because we have.
You got to be in the dark, in the
Well, we
basement.
have equipment that produces radiation, and we need lead-lined walls.
Right.
So it was a few years ago that they opened up a new building for like all the College of Health Sciences and Education, and we did not go simply because, you know, the structure itself was not conducive.
Right.
And like to pick up 2 X-ray rooms and move them was not
a
gonna work.
project. Yeah. Okay.
Yeah. But she will be in the new science center as far as physics goes and anatomy and physiology if she's going to need to take it again, which, you know, will remain to be seen.
Okay.
All right.
I'm assuming you guys did not have the opportunity to do the SATs?
Oh, okay. So she did get canceled 6 times, but then she did take it last week.
Oh, you did take it.
She ended up taking it. How did it go?
I think it went pretty well. Just thank God I like.
You know,
actually
she
took
waited
it.
so long and then they threw in an extra 4th test. They were piloting some 4th part.
No, the 5th section. I was actually
Oh, the
supposed to
5th
take the ACTs, but I kept getting like canceled so many times that I just decided to do the ACTs in the end. So.
No, SATs.
SATs.
She got canceled on both, but she
Yeah.
finally got an SAT in. Yeah.
We've really we've struggled with this. I mean, obviously it's happening to everybody, you know, and we've started to say now that we're not even looking at them, because if students can't take them, you know, it's not going to be a reason that we don't accept them. So we're looking at high school GPAs, things like that. But the reason that I ask is because essentially the registry exam is like a standardized test, you know, and we're talking about 200 questions. And I mean, we are preparing them for it throughout the 4 years, you know, constantly retesting, retooling. You know, we're going to say things to you and you're going to be like, if you say this to me one more time, but we do it for a reason, you know, so you're ready. And then in that senior year, whether it be in December or May, we have a full-blown registry review, you know, to prepare you. So our pass rates are what they are because you're well prepared, but also the ability to do well on a standardized test helps.
Yeah.
You know, it's the difference between the 78 passing score and the 92 passing score.
Okay.
You know, so just to kind of keep that in mind.
Okay, great. All right.
Other questions, guys?
I don't think so. I mean, she did get the postcard in the mail offering, like, should she come for a day and
to
shadow, observe, like, how do you feel about that?
You know, I reached out and I sent them all out those postcards, and I'm getting a lot of replies on them, which is a good thing. They're looking at probably waiting until the spring semester to do those visits in person, only you know, obviously because of COVID. Right. But what I am offering up, if you're interested, and we can coordinate schedules, is I can bring you in virtually to one of my classes. so that you can kind of sit in and watch me teach and, you know, kind of hear some background. I'm teaching the intro course this semester, which is a nice one for people to sit in on because it won't scare you. And you'll be able to follow along. You know, you won't be, I mean, we're not going to put you in a radiation physics course before you start the major. That, you know, that's crazy. But I teach Monday, Wednesday from 3:25 to 4:15. So I don't know what your school schedule is right now, but if we can coordinate, I can get you in, you know, virtually to my class if you'd like to join us.
She could probably do any of those times because right now her school district ends at 11:40 every day. Yeah.
So, but is it all online?
No, we do this cohort schedule where it depends on the last name. So they go Monday, Tuesday in school, all virtual Wednesday, then we go in school Thursday, Friday.
Yeah.
Okay.
So A through L is Monday, Tuesday, and then M through Z is Thursday, Friday. Yeah.
Okay. Yeah, that's what they're doing locally here for me. I'm thankful that my son's an adult and we don't have to worry about that. My brother's struggling with my nephew who's a freshman and trying to learn online, and it's not pretty. But you know, so yeah, so this week actually is I have a guest speaker and a test. So this week isn't going to be good. I also want to take a look at the topic that I might be teaching too, because I want to bring you in on a topical area that is going to be interesting to you, you know.
She's just grabbing a pen to write it
down. I'm still living on a paper calendar, Mom, because this this is how I need to live my life.
Yes.
I have them all in my phone, and I love technology. It's great, but I
love the antiquated people. It's okay.
And you know what? And I say this, and like my colleagues laugh at me. If I could teach them X-ray on film again, I would.
Oh, all right.
We'll go back to film in a second. Yeah. So this week is not good, but the 19th is a good topic, and so is the 21st. So either Monday or Wednesday that week would work, and then Monday the 26th is another good topic if you have an interest in that.
Well, I guess the 19th, right? Are you okay with that? That's fine. Yeah.
Okay, so then what I will do is, it won't be Zoom. The platform that it's going to be is something called Collaborate. So it's just our learning management system. Are you guys working on Google Classroom for your high school?
Yeah, we do Google Meets.
Yeah, so it's a similar platform. It's called Blackboard Collaborate. So what I will do is I will send you a link, and essentially it'll say to you link to course room. You'll enter the course room, and then you'll be able to see my PowerPoint. You'll be able to see me. I'm going to warn you, I don't like to be tied to the podium when I teach. So you may hear me and then see me run away to point at something, and then I'll come back. But at least you can kind of be in, you should be able to hear then the questions that the students are asking. So I think it'll be the best experience that you can have considering the circumstances.
Great. That sounds good.
I'll get that set up and I will email that out to you.
Okay.
And I think that being in there is going to be a good experience for us both.
Great.
Now, what traditionally happens, guys, is, you leave open house, you have no more questions, and then you go, oh, I wish I would have asked. So what I will do is I will send you out an email with all my contact information so that we can be in touch.
Great.
Any questions that you have, if you want to set up another virtual meeting like this, we can absolutely do it. So I'll send you all that information, the link to the course room, and we'll be set for our meeting on the 19th.
Okay, great. Thank you so much.
You're very welcome. Is there anything else I can do for you guys today?
Not at the moment. Yeah.
I think that's pretty much it for you. I mean, do we go back to, is this it for the day or?
This is it for the day. They're doing campus tours. So there's a link on the open house webpage that you originally visited for the day. If you would like to do the virtual tour.
Okay.
But beyond that, there are no other scheduled sessions for today.
Okay, great.
It's actually much shorter in the virtual version. Because normally what would happen now is we would take you to lunch.
Oh, right. Okay. That's all we keep doing is eating. All right.
Isn't that the truth?
Well, thank you so much. This has been very helpful.
Yeah.
I'm so glad that it was. And like I said, I'll send you out all that information. Please stay in touch. And I look forward to seeing you soon.
Okay. Thank you so much. Have a great day.